prostate cancer needs testosterone, the male hormone, to grow. So you must shut down the male hormone. So ADT, or this androgen deprivation therapy, is to suppress the testosterone level. So you try and reduce the male hormone level. Okay, one way is to do orchiectomy. That means to remove the testes. So once you remove the testes, the testosterone will drop and the cancer will also reduce. Another way which you may have heard more is injection. There are many different brands of injection like Zoladex, Lucrine, Lupron, and all these Pharmagon. All these medicine is to reduce the production of the testosterone or male hormones. When a patient has stage 4 prostate cancer, we actually have to discuss with the patient about starting with the ADT, and together with these new drugs, which you may or may not have heard of, such as apalutamide, enzalutamide, or abiraterone, and then taxotere is a chemotherapy. So usually we combine the treatment here, and then after some years, when they become resistant, then patients go on to other treatments. So one is, we now start with a new oral hormone therapy or chemotherapy earlier. That means together with the ADT, the patient will take the new hormone therapy or chemotherapy earlier. Then these other three are the new treatment that we have for prostate cancer. One is a targeted therapy called PARP inhibitors. Another one is a radionuclide therapy called lutetium. And then lastly is immunotherapy. Okay, so these are the new oral hormone therapy that we add together with the ADT when a patient is diagnosed with stage 4 metastatic prostate cancer. So these three, abiraterone or Zytiga, enzalutamide or Xtandi, and apalutamide or Eladia, all these three are oral hormone medicine. And taxotere or docetaxel is a chemotherapy. Okay, there are a few PARP inhibitors. There are two now in the market. One is olaparib, and then the other one is called rucaparib. But there are others like niraparib and talazoparib. Okay, so what are these drugs? These are oral targeted treatment. They can target the cancer cells. Okay, so how does it work? Okay, for this PARP inhibitor to work, there's this thing called genetic testing in prostate cancer. Okay, so the patient need to test for this gene called BRCA1 and BRCA2. This is a gene you see in breast cancer, ovarian cancer, but prostate cancer patients can also have this gene called BRCA1, BRCA2. Okay. So about 10% or slightly more of metastatic prostate cancer has a gene mutation that causes the gene repair defect. Okay, so if the patient has a gene mutation defect, which you can find from genetic testing, then the oral PARP inhibitor works well for this patient.